My name's Kristina Rafferty. I'm Operations Support for Jim's Healthcare. So Jim's Healthcare really came about because there was a need from both a client perspective and a health professional perspective to look at opportunities. So what opportunities there were for a health professional joining the market, and also, I guess, utilising the Jim's Group clientele or clientele base to look at what services we could provide that perhaps they were already utilising as well, like mowing or cleaning or etc. So Jim's Healthcare will offer services in the in-home and community support area, but also will scope out to nursing and the different duties that are involved in nursing, and as well as allied health professionals, so physios, OTs, dietitians, social workers and speech therapists. I think it can suit a lot of different health professionals. I think it can look for someone who's got quite a bit of experience perhaps under their belt that wants to branch out a little bit and utilise those skills to affect a greater number of people, have a little bit more autonomy in their life. They might be looking for flexibility with families, or they might be just looking for a new challenge in their life, really, to broaden their horizons a little bit. Well, I think the Jim's brand, or the Jim's Group brand, is actually built off trust and people being experts, I guess, in their area, what they're providing. So we really want to extend on that. We want people to feel like they can trust us to come into their home and help them, or their families or their loved ones. We're getting asked, I guess, about the different types of services that we'll be offering. We get asked a little bit about, I guess, some of the more regulatory or governance compliance aspects that are really, really important in healthcare. We're getting asked about the different opportunities that might lie and what sort of services they can set up under. We're getting asked about the locations that are available. So I'd invite anyone, obviously, that's interested in a Jim's Healthcare franchise to come and just speak to us. So Jim's Healthcare set up quite an extensive range of policies and procedures, and we've got very strict compliance measures in place. Obviously, the franchisees themselves can undertake the process of obtaining their own registration, whether that's in the aged care space or whether that's in the NDIS space, and we can encourage and support that as well. So signing on as a Jim's Healthcare franchisee, I guess you get a whole gamut of support. So you get a franchisor who's dedicated to helping you run your business. You will also get assistance, from vehicle signage through to literally providing a service to a client. You have someone you can call on all the time, and I guess having expertise in different areas within healthcare will also be provided from a Jim's Healthcare divisional, I guess, point of view. So currently we have franchises available across Australia. So we're a brand new division, so I think now's the time to sort of get in early. We've had a lot of interest from potential franchisees, people asking lots of questions. So there's a lot of scope, really. Well, I think Jim's Healthcare offers so many different opportunities, but you can be a sole trader, you can be someone who works for yourself and sets your own hours and sort of chooses the work that you choose to do, versus someone who wants to come in and put on a team of staff in different areas within healthcare. I think the options are endless. There's so much demand for nursing in all states of Australia. I think you have so many different skills that you can provide across the board. We have people in, like I said, the aged care space. We have people across all different walks of life that need nursing support. Jim's Healthcare has a $1,500 pay for work guarantee, which essentially, I guess, guarantees an income, particularly in the early stages of your business, where you might be jumping from a salary role to working for yourself. So I guess it gives you that reassurance that you'll always be making some money. So all franchisees that sign up with Jim's Healthcare will go through a 3-day generic training through Jim's Group down at headquarters. So after you've been to Jim's Group and done your 3 days of generic training, you'll come to us and do a 3-day divisional specific healthcare related training. So our divisional training really focuses on setting you up to run your business. So you'll be run through different software programs. We will talk more about policies and procedures and why they're so important to follow. We'll look at different ways that you can look and seek for work, particularly while you're sort of developing a business, and we'll introduce you to that concept of supervision and the guidance framework that we can provide from Jim's Healthcare. We're looking for people who are motivated, who are driven, who are happy to have a challenge, I guess, in their life and want to try new things. Jim's Healthcare offers so much flexibility for new franchisees. I'm a mum, I have 4 children. It's really important for me to be able to drop my kids off at school and pick them up at the end of the day. It's great that you can build a business that allows you to work around your family and your family needs. If you want to know more about becoming a Jim's Healthcare franchisee, please call us 131 546 or just visit us on our website at jimshealthcare.com.au.